We are going to discuss on clavicle. As you can see, this is a clavicular bone. It's an S-shaped bone. What kind of bone this is? Is it a long bone or short bone or say small bone, or what are the types of bone? What are the kind of bone this bone is? This is a long bone because it has this is the acromial extremities, or you can call it lateral extremities, and this is the sternal extremity, or you can call it medial extremity. So because of that, and the shaft and the body, because of that, this bone is regarded as the long bone. So now, when you are asked to describe clavicle, the first thing you need to know is that where is this clavicle, where is this bone located? You have to talk about the location. One, you have to talk about the shape of the bones. You have to talk about the articulation of the bone. You have to talk about the color if possible, and some structure, prominent structure that you found if possible, include the blood vessels, nerve supply. So let's start by defining what clavicle is. Clavicle is a long bone that connects the scapula, or that connects the axial skeleton with the upper limb. And as we said, it's a long bone that bears an external or lateral extremities and the medial extremities, as well as the shaft. The lateral extremities connect with I'm talking about the joint, the articulation now. The lateral extremities connect with the acromion process of the scapula to form what is called acromial clavicular joint, while the medial extremities connect with the manubrum of the sternum to form the manubrosternal joint. When you are going down from the lateral extremities, when you are coming down to the body, there is a projection, tuberosity, there's a prominence structure which is called coronoid tubercles before the attachment of the muscles. So now, when you look at this very careful, you find out there are other places that are soft and there are places that are somehow rough. So the superior parts of the clavicle are soft, yes, are smooth, while the rest of the part of the clavicle are very rough. That gives the attachment, is for the attachment of muscles. So when you look at it, coming down is an S-shaped bones. It's an S-shape. It looks like X, S. I mean, not X, S, or double curve. It's curved, concave and convex shaped. When you know what's concave and convex, so this bone has two curve shape, both concave and convex. But the easier way is to say the S-shaped bones, which articulate with this medially and articulate with that laterally. So I've talked about the shape, I have talked about the location, I've talked about the nature of the bones, just of roughness and smoothness of it. Then I've talked about now let's talk about the functions of the clavicle. Actually, clavicle is very, very important in the sense that it's the only bone that connects the axial skeleton with the upper limb. It's the only bone that connects the axial skeleton with the upper limb. That is one of the functions of it, and it allows free swinging of the hand. Free swinging, you can rotate your hand freely, but is prone to fracture because of the full force it bears. It prone to fracture. So one of the problems that clavicle come in contact is clavicle can be easily what can be easily fractured. So talking about the functions, these are the functions. So I'm going to give you an assignment. You have to write the blood supply and the nerve supply to clavicle. This is an assignment for you. If you are serious, I want to know the in the comment section. Just drop the nerve supply and blood supply to the clavicle. I want you to encourage by subscribing, by sharing, and by supporting. If you think there's anything that we can improve the study, please, you are welcome. You are welcome. Just do your necessary. We can do our best. Thank you. Bye.